What is the link between disease and refractive error diagnosis? Imagine your eyes as tiny, complex machines that not only help you see clearly but can also tell a story about your overall health. When eye doctors diagnose refractive errors like nearsightedness, farsightedness, or astigmatism, they are doing more than just helping you see better. They are also uncovering clues about your body's health. Refractive errors happen because of changes in the shape of your eye or how light bends inside it. These changes are usually related to the length of your eye or the curvature of your cornea. But interestingly, some of these structural differences are linked to systemic health conditions. Research has shown that people with myopia or nearsightedness often have a higher chance of developing type 2 diabetes. This connection isn't just coincidence. It appears that certain genetic and environmental factors influence both eye growth and metabolic health. For example, individuals who are obese and have myopia are at an increased risk for diabetes. However, engaging in regular physical activity can help lower this risk. This suggests that lifestyle choices play a role in both eye shape and overall health, and that these factors are interconnected. From an anatomical point of view, the measurements taken during refractive error diagnosis, like the length of the eye or the shape of the cornea, can also reflect broader health issues. For instance, a very long eye is often associated with high myopia, which can increase the risk of eye conditions like glaucoma and macular degeneration. These structural changes can sometimes be influenced by systemic health factors, although refractive errors are not strongly linked to conditions like osteoporosis or liver disease. So, while some systemic diseases share common pathways with eye structure, the connection is specific rather than universal. Genetic studies support this idea too. They show that refractive errors are influenced by multiple genes and environmental factors. Some of these genes are also involved in processes that affect other parts of the body. This means that understanding the genetics behind refractive errors can help us learn more about how other systemic diseases develop and how they might be connected. In the context of diseases such as glaucoma and macular degeneration, knowing your refractive status is important. High myopia, for example, is a known risk factor for these conditions because of the structural changes it causes in the eye. Detecting refractive errors early allows eye care professionals to monitor for these risks and intervene sooner, potentially protecting your vision. In summary, the link between disease and refractive error diagnosis is multifaceted. It involves shared genetic and environmental influences that affect both eye shape and systemic health. Structural changes seen during diagnosis can also serve as indicators of broader health issues. Recognizing these connections helps eye doctors not only correct vision but also identify potential health risks. That's why comprehensive eye exams are so valuable. They can reveal much more than just how well you see. Always remember to consult healthcare professionals for personalized advice, as individual health varies and requires tailored care.